Today's the theme is AI. Just like to introduce a little bit of my personal view about what's the impact on medical education. We had some discussion already about medical service and research. So I just quickly go through the AI digital literacy concept, and we all were familiar with for the time being. And also in psychiatry, talk about cognitive function much better than automatic in other fields like automatic driving. So we really emphasize the problem solving, reasoning, learning, and reception. We also want to see psychiatry is all parts of AI from a different area. In Canada, we are quite proud, the first country to have a national strategy, and probably heard we just got a Nobel Prize in University of Toronto about AI. University of Alberta, we have a big group, long tradition for AI research. First computer science department in University of Alberta, we have many world expert for this. Even the DeepMind is the first start in the University of Alberta. So in the, we rank number 2, and AlphaGo is coming from Alberta researchers as well. So AI application in healthcare, there's a lot of coverage today. I don't want to emphasize too much, but everywhere from omics, clinical, patient-generated health data, just like Yanbo said. And certainly there's a lot of consideration about the pros and the cons. And here's the team approach, and most important is the collaboration. That's all about it today as well. And how to integrate in clinical practice. And then there's a different approach, different opinion, and we can see there's a software, hardware integration in different steps. But also in clinical decision making, supportive tools, not to replace human being, improve accuracy, efficiency, and also there's a learning opportunity for AI doctor, AI patient, just like mentioned by Yanbo. So patient-centered care and AI is the focus. And then I want to emphasize student-focused AI in medical education. So clinical practice is changing. We all know that. When we're talking in the media, we're always thinking is pathology, lab medicine got automation. But in psychiatry, it's so fascinating because we are so culturally oriented, language intensive, then pose some challenge for AI, but that's also have a huge opportunity for AI with us. So we have a different platform, different technology, real-time access to big data, and different regulators, insurers, and sometimes our health record is for the purpose of billing, not necessarily for the purpose of diagnosis. We all know that part, especially in psychiatry. Yeah. Before, we have one doctor to one patient, one doctor with one patient for another 30 years, like Freud. And if we do that with AI, that's a different dynamic. Yeah. So in AI in health, informed consent, transparency, patient autonomy, all the concept we have been talk about over this conference. So I want to spend a few minutes to talk about my personal understanding, also this learning process about medical education and AI. So AI, we want to see the definition, application, and the potential in these 3 areas. So the current medication, we have limited exposure. Training is totally different in different settings, different mentor, different preceptors, different clinical scenario. And it's quite time consuming, and that's the current medical education. We always complain our textbook is 5 years backward with the real world technology, but we still study the textbook medicine even 5 years. And then basically what we do is training the ability of learning, not necessarily really training our ability to remember the knowledge. So the role of AI in medical education, I try to summarize, is a personalized learning. So we have a personalized medical care. Right now, we should have a personalized learning. And we have improved diagnostic skills, access to resources, rather than emphasize on skill and knowledge. So we emphasize the utilization of a virtual patient, simulations, adaptive learning platform. All medical school, 5 years. In some countries, in 6 years, and in North America, 4 years. But adaptive learning platform is individualized. People can finish some rotation early. If needed, patient can extend rotation. So right now we call it competency-based training approach in Canada, called a CBT. So how to implement strategies for AI in medical education? So the curriculum integration has to be the start point. And we had to train the trainers, called educator training. And then the collaboration with the different computer scientists, psychology, education expert, clinicians. So it had to be collaboration, and in both ways. Personalized learning pathways would be a strategy for the next few years. Adaptive learning, algorithm, just like a play computer game, is how to progress, the totally individualized. And we have to emphasize not a time-based training, have to be competency-based education. And a lifelong learning platform available to the people close to retirement, people, junior doctors. And then this collaboration is always team-based learning and virtual collaboration spaces. Not necessarily have to be supervised directly, right at bedside. Can be virtual collaboration. Interprofessional education will be very important as well. In different specialties have different application styles. So specialized training is a little bit different. And certainly surgery will be a lot of simulations, and psychiatry will be a lot of real-world patient interaction and simulations. And then we should have assessment for assessment, basic competency assessment. AI in surgical training will be very interesting, focus on simulation technologies, skill enhancement, and certainly patient safety will be very important. In mental health, just like today, we focus today, is diagnostic support, psychoeducation for family, patient, and allied health worker, family. Stigma reduction, use AI. But we also have to careful about the pseudo-empathy, the concept we talk about today. AI in medical imaging, that's the one in public domain, very much so. Diagnostic assessment, assistant, workflow efficiency, early detection, just like CT for the lung, and got so many new patients. AI and medical education research and innovative teaching methods. And right now, the transition for the next few years will be dramatic from didactic to self-learning and called proactive learning, adaptive learning. Learning analytics will be different method to do those summaries, research, evidence-based practice. In psychiatry, right now we're talking about called measurement-based practice in psychiatry. And then in all medical education, we call it evidence-based practice. It's a global village, AI and global health equity can access to healthcare online, virtually, and to address health disparities. And then collaborative effort across the different region, different time zone, and different parts of the globe. So AI and CME also very interesting, especially nowadays. We have a lot of online CME resources online for the last almost 20 years. But right now, it has to be proactive, adaptive, CME. So try to adapt to individual need, lifelong learning, personalized learning online, and peer collaboration with the next wave of CME. We always focus on ethics when we talk about AI. But AI actually can help ethics in education. So ethics decision-making, use AI facilitate, not just powerful committee to make sure the ethics is considered, but AI can also apply to have consistency. Ethical awareness, use AI, professional integrity, have all the factors covered by AI tools. And AI with patient education, health literacy, treatment adherence, and empowerment, really powerful for AI and patient education. And in the Alberta, we use text for text messages for patient and have a wonderful improvement about adherence. Just send a simple text to the patient and remind the patient, you're good today. How are you today? Have you taken your medication? Let me know what's going on. AI and healthcare workforce development, skill enhancement, professional growth, and workforce resilient. Burnout, stress at the workplace can use AI to prevent, assessment, help. Also, patient safety education is also important. In our practice as a physician, we always focus on patient safety, but most time we put effort after something bad will happen. So we really have to emphasize error prevention and quality improvement project and program and team training. Yeah. Research skill development and methodology, data management, publication support. We all know use ChatGPT to do literature search or summary, even whole book can summarize in a few minutes. Knowledge sharing and cultural competency. AI in medical education and medical care, there's no discipline than psychiatry needs more cultural sensitivity. The cultural sensitivity in psychiatry is so important. So we talk about cultural sensitivity to the patient population, but with our own healthcare team, we talk about cultural competency and capacity building this way. Actually, in policy and governance, also regulatory framework, responsible AI development, international collaboration have a guideline. Certainly, we saw the news. Americans have a different opinion, different approach compared with the European countries. Everybody has their own constitution according their mentality and the cultural background. And nothing wrong, nothing right, but people pay attention. Data privacy, and always talk about it, but at the same time we have so much trust to our bank about our financial privacy, but for the medical privacy, we could not emphasize too much. We should emphasize as much as we can. There's a bias and fairness, accountability. Sometimes probably only rich nation, rich university, or rich city, or rich person can get a better medical education supported by AI. So we have to consider the bias and the fairness, justice. For clinicians, we have to combine narrative. We should not learn medical only from YouTube or AI. Have to combine narrative, mechanistic, mathematical thinking. So we have to think differently, not just have so many books remembered. And the physician decide which AI tool best for patient, just like in neurology, we should use CT or MRI today for this patient. But physician decide which AI tools best for the patient. And the medicine and AI interface will need to be skillfully managed. Last time on memorize medical information, we are very good, or we have to be very good, memorize medical information for the last 100 years. Probably less so in psychiatry, but we have so many theory and proposals and background knowledge for psychiatry more important than the current concrete information. More time on new technology, so this release psychiatry to look into more technologies rather than fluid psychoanalysis. So future physicians will need a broad range of skills. We certainly have to be good with principles of medicine, knowledge of mathematical concepts, AI, fundamental and data science, and understanding ethical and legal issues, and also focus on communication and leadership skills. Emotional intelligence, this keyword we should emphasize a lot in our medical education, especially in psychiatry and mental health education. So AI for clinicians, to summarize, have to understand AI in the same way as any technology. Just like CT, ultrasound, MRI, when they show up, we're thinking we'll have a solution for everything. Gene sequencing, we're thinking we had everything can cure disease, but it's not. So we have to understand AI, when to use it, how to interpret it, how to explain to the patient. That's just like a CT or MRI. Personalized medical education will help from AI. AI as external hard disk for medical students or medical professionals. And AI tailored to learning materials, and AI as a personal tutor. So the future of medical education, medical school will be with open structures, minimize barrier, such as school location, time zones, connects learning across the world, and then allows seamless transition from one place to another, one phase to another. Just like our journal, paper journal for the last 100 years, use the journal, we learn each other. And then internet, right now with AI, is dramatically more powerful. So provide guidance by expert far away, we all do that. AI revolutionized medical education by personalized learning experience. We're always talking about personalized therapy. Right now, personalized learning experience in medicine. We enhance diagnostic skills and improve access to resource. Implement strategies include curriculum integration, just like I said, and educator training, training the trainers, and collaboration with AI expert. So AI expert could not do medicine, and medicine expert could not do AI without AI expert collaboration. So what do? We have to embracing AI is essential, nobody can escape. Prepare for future healthcare professionals, addressing global health challenges, AI can help. Thank you.